Good morning, and again, welcome to Tabernacle Seventh-day Adventist Church, our Sabbath School program, as we continue with our health nugget for today. Again, I'm Baldwin English Jr., an elder here, and with Dr. Carrington, who you have seen sharing with us before in this format through the health nugget. I'd like to get right into it, Doc, because we have a lot to cover and just a few moments. So since the last time we spoke, several states have loosened up their restrictions and regulations in regards to the COVID-19 lockdown. Are there any early indicators that have raised concerns among other public health officials like yourself?
So far, as you rightly said, which is a very good question, the crave to reopen has seemed to be taking over our country. And many people who have been unemployed, people who can't even come to church like we usually do here, are pretty somewhat irate. Some people are. And we've seen the vivid demonstrations in the streets as to what they are doing in order to intensify and accelerate the need to get back to usual. However, in the country, we are still seeing in many of the states a rise in COVID cases and an increase in deaths in many states. It is true that in states like New York and maybe even in Florida to some degree, there's been a plateau or a reduction in cases, but there is still a lot of active disease present in the population. And that's a pretty scary thing when it comes to reopening, because the amount of disease that's present is also something that can be quite damaging to the society as time continues. So even though we have not seen any early trends yet as to what could happen, the predictors for those trends are there. And the mere fact that we are not able to control the disease properly yet, and the fact that the disease rates are going up in some areas is a cause for some alarm, because we don't really want this problem to be persistent in the population. So far, in the majority of places, we've only screened about 10% of the population. America has 360 million people, and so far we've only screened maybe about 30 million or so. In Florida, we have about 20 million people, and we've only screened 500,000 people. So there's so much more room for disease to affect people and to cause significant disease. I compliment the governor of Florida for trying to make some headway into safeguarding the elderly by screening elderly people more aggressively. However, the elderly people who are not in nursing homes are still going to be at significant risk. So when we reopen too early, we run the risk of sending the wrong message, of telling elderly people that you can come out and you can do things as usual, you go to Publix and shop, not knowing if you're going to be exposed to a particular pathogen in the community. So for me, that's a significant concern, and one that we should be careful about. We want to protect our elderly, and we want to protect those in our culture or our communities who are most challenged. The people in lower socioeconomic classes who may not be educated properly, who may not have heard all the news, who may not have gotten all the information. Those people are still going to be doing things that they should not be doing and cause significant problems. Just this week, I heard a story of a family who had one family member infected, and this family had about 11 people in the house, and that patient was told to quarantine at home. So she's at home quarantining with 10 other people. Furthermore, she still goes to work on the side. She still goes to the grocery store. She still does all the things that she's not supposed to do while she's quarantining. And the kids are being exposed to her potential infection for them. So these are the kind of challenges that we face, especially in lower socioeconomic communities. And as a consequence, those are the things that I think we should also be worried about. And we should implement safeguards to try to help obviate the potential consequences from that.
So continuing on that thought process, in terms of opening back up, there was the Spanish flu, right? Back in 1918, and it killed approximately 50 million people worldwide, 675,000 people in the United States, which is more than all of the people that died in World War I, World War II, the Korean War, Vietnam War, Iraq, the war in Iraq and the war in Afghanistan combined, right? And what lessons, considering your public health background, what lessons have we learned or should we have learned back then? Because my understanding is that there was an initial wave, and then if you look at the pie chart, the second wave of the Spanish flu is what really did most of the damage. It was 5 times as many people died during that second wave. So what lessons have we learned or should we have learned from the Spanish flu that we should or are applying today?
That's a very, very, that was a very sad scenario, and it's one that we haven't fully learned lessons from yet, unfortunately. The same things that some people are trying to do today to reopen early is the very same thing that happened in 1919 during that period of the Spanish flu. After it began in 1918, they had this initial wave of significant disease, and then people decided that they would come in and celebrate after the first wave was over, and it only led to more danger and destruction in the second wave, and they even had a third wave in 2020 that was a little bit smaller, but still there was significant damage to the population as a result of the eagerness to return to normalcy. And when we return to normalcy without adequate protection, without adequate knowledge of how the disease is going to operate, without adequate knowledge of how to treat the disease or how to screen for the disease or how to protect people from the disease or to prevent it, then that becomes a significant problem. And I really think that not many countries have learned the lesson from that 1918 pandemic, because even in our country, we noticed that we were not as well prepared as we should have been. We were a little bit delinquent in our response to how we should take care of this pandemic in the first cases. When the first cases arose, we were a little bit slow in reacting because we thought it was going to be a simple virus that we were going to have. And as I don't want to quote the president, but as some people said, it wouldn't last too long. You know, we did not have all the resources in place to cover as a result of the high potential damage or death rates in the communities and hospitalizations, and we all became scared because we weren't adequately prepared for that. And if we are still not adequately prepared and there is a second wave from this coming on to the end of the year, we're still not going to be prepared. We're still not going to have adequate amounts of protective equipment. And as a consequence, we're going to see increasing amounts of death. And this is a huge challenge, and we definitely need to work hard at preparing so that we can do better. My grandmother used to say, an ounce of prevention is worth a pound of cure. And as a consequence, I think we need to be in that preventive mode. This is a novel virus. It means it has never existed in this universe before. And as a consequence of having novel virus, we don't know much about it. And the more we see this virus, the more bad behaved it becomes. This virus affects almost every single organ in a person's body. We first heard it was just a pulmonary infection, but last week Dr. Ned told us about some of the neurological complications, and there are also cardiac and renal and musculoskeletal, and every kind of complication you could think of happens from this virus. Because we never knew about it before. We thought it was going to be something simple. It is not something simple. It is something that we need to be cautious about. We need to do everything to prevent. And unless we are working in that direction, we're failing to learn the lessons from 1918.
Thank you. So the CDC has acknowledged and put forth data that suggests that there is a disparity, a racial disparity, in contracting and dying from this disease. And to be more specific in that, Black people are people of color, certainly, are far more impacted by it. We're dying at a disproportionate rate. What should we be doing to mitigate this disparity in terms of the impact of this disease?
That's a very, very good question. We in our culture, especially in the South Florida culture that we live in, we have a population that is primarily Hispanic and African American or Black. A lot of us are not only from the United States, but from different Caribbean islands. We come to this country looking for a better life. Both Hispanic personnel and other Black people. And when we come here, we come looking for a better life. Unfortunately, when we get exposed to some of these diseases, it doesn't always lead to a better life. Unfortunately, in lower socioeconomic communities, African American, Hispanic, we are not always the best keepers of our health. We tend to be a little bit nonchalant in healthcare. We tend to go to the doctor at the last minute. We don't go at the beginning of a syndrome when it first begins. And as a consequence, we usually present when the disease is far gone and when we're getting ready to die. And as a consequence, our mortality rates become higher. Secondly, we don't really practice all the preventative things that we need to do. And I think the main reason is the gospel according to Selwyn Carrington. I think the reason why we don't do this is because we are not well educated as far as health and health issues go. We tend to depend on what our grandparents said and what our great-grandparents said, and we don't get evidence-based information to help guide us in our healthcare. And there's an old saying that if you want to hide something from us folk, you got to put it in the book, and we'll never find it. So we don't really get the education that we need on these health issues. We visit doctors less frequently. We don't seek to go online and learn information. And when we do go online to learn information, we get confused by what we see. As a matter of fact, for my dissertation, for my PhD, I was studying this kind of behavior in African American and Hispanic young people, and even the young people say that they don't like going online because they don't understand what they see, and often what they see online is quite confusing. So as a consequence, they don't trust or they don't entertain online information that much. So we need to find a way to bring competent education to African American communities. We need to have people of color, Hispanics, African Americans. We need to provide appropriate education. And the other thing in the Hispanic population is language. And in the Haitian population, the same thing. Sometimes we don't understand the English that well, and as a consequence, we just discard it because we can't learn fast enough. But we need to find creative ways in order to educate our communities as to what's going on. And I think this is an important role that the church plays. Our church has the ability to come to grips with the challenges that our community faces. And I'm very grateful for Tabernacle Seventh-day Adventist Church and the healthcare professionals that we have here who are very keen on educating our communities. But this doesn't only need to happen at Tabernacle, it needs to happen everywhere. And other communities need to be educated and have at their access people that they can call, talk to, ask questions, and find out information as to how they should respond when something is coming up. And they need to have reliable people, trustworthy people that can give them the facts as they are, and as a consequence, they'll be able to do the best to handle the appropriate health issues that pop up. And COVID, which can be quite deadly in our community, 40% of us could be dead from it, we definitely need to make sure that we educate people well so that they can know how to prevent this disorder.
Thank you. I was on a call this week, one of the many Zoom calls that I had to participate in, and it was brought up, the Tuskegee experience was brought up, and so I think that there is, amongst some pockets in our community, there's a distrust with, vaccines and so forth, and that's a whole nother discussion we'll save for another time.
Right.
But I would like, Doc, in terms of some of the issues that we face as a community, I know that you've written a book. I haven't read all of it yet, but I've read a lot of it, and it deals with some of these long-term, I guess, chronic diseases and so forth, issues that we have in our community. Tell us a little bit about this book, where we can find it, what the name of it is, and so forth.
Well, the book that I've written is called Design for Health, and it's intended to improve health literacy in African American, Hispanic, and all communities. But primarily, it's addressed to especially young people. As a matter of fact, one of my readers told me that when they got the book and they read it through, it says, "I wish I had this book when I was 20 years old," because it gives you information that helps you to develop preventative methods and a kind of direction in life as to how you should go with holistic health care. And the purpose of the book is supposed to guide us in that direction. We want people to be able to develop a plan to maintain good health, not only for this life, but for the life to come. And we want people to understand what is involved in maintaining excellent health care. The book is available on Amazon. You just go and search for Selwyn Carrington books. There's more than one, but you can see that one, Design for Health, and it's available for everyone to purchase on Amazon. So you can be my guest, and I definitely would appreciate the support. But yes, we definitely need to create some directives for people to go as far as asserting themselves in developing good health care for themselves and understanding what needs to be done. And we need to be educated in that direction.
Well, Doc, I thank you for making yourself available again. I believe that we will have to have you back again. I think that the governor just extended the stay-at-home order for a while. There's some of the emergency lockdowns that we have here in the state of Florida, so I'm sure we'll have to have an occasion to bring you back here to speak directly about these issues. So thank you again. Thank you for joining us, and stay with us as we continue into our divine worship experience.